Hi, I'm Dr. Natalie Marks, here with a Fountain Report conversation. It's my pleasure to be joined by Dr. Peter Weinstein. Peter, thank you so much for being here.
Natalie, thank you. Always a pleasure to be with you and to share ideas.
Well, we always have really thought-provoking conversation, and one of the things that is always exciting to think about are the trends and the innovations and even the companies to be watching. So, this year in 2025, what are you thinking about? What is top of mind?
I think AI is top of mind because alphabetically it goes right at the top of mind from so artificial intelligence, where it's going to fit, how we can use it, how we can use it to enhance our practice efficiencies, how we can use it to decrease stress, how we can use it so we can get home on time. So AI, I'm going to use a French word second, entrepreneur.
Love it.
I think that we are in the heyday of the next generation of entrepreneurs. I really look excited at not just the business side of entrepreneurship, but more importantly, entrepreneur veterinary hospital owners. I really am excited about the opportunities for new hospital startups, new business models, and even buying existing hospitals and looking to see if they can be morphed into new hospital models. And then finally, the one that always is on the top of my mind and of concern is the economy. I am just not sure where we're headed. If the reports that I continue to read show the ongoing downward trend of transactions with kind of an average of 3% growth in revenue, we have some definite economic issues that are going on impacting the profession. And I mean, I hate to say it, but it feels like we have a veterinary specific recession in terms of how the businesses feel in many areas, not all, but some of the businesses are feeling that, things are just really not what they used to be.
I'm glad you said it out loud because I think most of us have grown up thinking we are in an industry that's truly recession proof.
Mhm.
And we know that visits are down. We know that canine visits are down, which is sort of our bread and butter, right? What do you think about the feline role in the economy?
Well, if you want to talk about opportunity, let's get catty. Let's look for ways to address the patients that we have consciously or unconsciously ignored. I was just doing a talk, and I think when we talk about getting people in and reviewing all the pets in the household, what about the cats? The dogs come in, but we don't always ask about the other pets in the household and how those cats are doing from that standpoint. So I think we should put on our to-do list, our goals list, and our hope list is to let's re-engage the cats and the cat owners and try to give them what they need so that they can feel comfortable coming into the practice and receiving the care for their four-legged furry felines.
Say that 5 times fast.
There was an alliteration for you.
That was beautiful.
Thanks.
So you mentioned two things that I think some people may see as conflicting, right? We are talking about entrepreneurship, and let's just focus on new practice owners. And then the next breath, we're talking about potentially some recession, right? Or economic challenge. So, what advice are you giving to new veterinary owners or even students who are saying, hey, I want to own my practice. I have no idea how, and I'm kind of scared looking at some of these reports. What are some of the tips that you're giving them to be successful?
We have so much untapped opportunity if we focus on the fact that veterinary medicine is a service industry that delivers healthcare, and many of the, let's just say, legacy hospitals were veterinary hospitals struggling to provide service. I think if we're looking at entrepreneurship, we build a hospital that caters to the needs of the clients and the patients and the staff first, and less to the doctor. So I think there are a tremendous number of business models that can cater to the spectrum of care. And also, I feel a need for stratification of practices between the Ritz-Carlton and the Motel 6 and all the different Marriotts in between, although I don't know if a Motel 6 is a Marriott chain. But I think we've been always doing it the same way. Your practice in Chicago was delivering it fairly similar to the way my practice was in California. I think the practices in 25 and going forward should be delivering it completely differently. And we're seeing that with concierge practices and membership models. I think we need to look at looking at the needs of our clients and changing and morphing to meet those needs. Once you do that, you'll meet the needs of parts of your community that are underserved. And when I'm talking about underserved, I'm not talking about financially underserved. I meant professionally underserved.
So when we think about these new models, and one of the challenges you didn't mention, but I know we've talked about this ad nauseum, is the staffing situation, right, in the profession. So you come in, you're excited about a new hospital, and then you think, how can I recruit new associates, new team members when I can't compete maybe with a large corporate entity, or I'm just starting up, I've got all these loans. How do I offer bonuses? What are some of the strategies you're giving these entrepreneurs in regards to not only recruitment, but retention in these new models?
Well, I'm going to go bass backwards for you. If we focus on retention, we don't have to worry about recruitment. So find good people, put together formal orientation, onboarding, and training, and never stop training, and focus on growing people to whatever outcomes that you need. And it really starts with job description, it starts with expectations. And if I want to go even further back, it starts with having a vision that is societal in nature, socially focused, because most of the younger generation of doctors and staff want to make a difference in the community, not just in the business. So if you can find the right team, train them, learn how to use leverage and delegation so the doctor does what they have to do and the team can contribute everything they have to do. And then the 3 R's: respect, recognition, and responsibility. Show them respect, give them recognition, and increase their levels of responsibility, because people don't leave for money. They leave because they don't feel that they're making a contribution to the practice. Focus on good people, skills to retain those people, and then have them help you choose the next group of people for the team. Because the biggest mistake I made as a hospital owner is choosing people who are too much like me, which didn't meet the needs of the culture of the practice.
I'm so glad you said that. I made similar mistakes. And one thing I learned along the way, which it was a little out of the box, I think many years ago when I made it, but was really, I think, very smart for our hospital, was actually when you mentioned we are a service industry, is I found it was much easier to find people where customer service skills was their core and teach the medicine
Right.
than the other way around. And I see you nodding, you're in agreement.
100%.
Okay. And are you stressing that as well with these entrepreneurs?
Absolutely. Hire for personality, train to trust.
Love it.
Yeah, I mean, you can't change people's personalities as easily as you can change their skill set. As I would joke, there are only a couple of places to put a thermometer. We can teach somebody what those places are. We can't teach them how to smile and be happy.
That's right. So you mentioned at the beginning, since we're kind of taking the other way around here, AI.
Mhm.
And there's still a lot for us to learn about AI, right? And the legalities and implementation and understanding the true models behind AI and what's really going to stick. But one big area everybody's focused on right now is, of course, the scribing competitors. And I say that a little tongue in cheek because that's not enough,
Right.
right? So, what is your vision? What do you think is needed for these scribing, and we're going to call them co-pilots, right, of AI to truly succeed? Who's going to be left standing? You don't need necessarily need the company, but what are they going to have as assets to provide to practices where AI truly makes a difference?
So I've previewed a bunch of them, and my daughter is actually testing them. My daughter is a young veterinarian. What I'm looking for is something that can almost read my mind and fill in the gaps that I may have left for the medical record side of things. I talk about the fact that in human healthcare, when they used to use scribes in the room with the doctor would get home 2 to 3 hours earlier. I would suggest that the AI scribes can do the same thing. Now, the most important thing to me that the AI scribes need to ultimately do, and I think it's in one of the PIMS, is integrate with the PIMS so it's not a cut and paste situation. But once that's the case, and I was just talking to a veterinarian who has a trouble with AI because she's a real introvert, the goal is to communicate. And AI just picks up your communication. And if I'm having a conversation with me as the doctor and you as the client, and the AI takes that and interprets that, here are the physical exam findings, which I can dictate. Here's the treatment plan, which it can take down. And if it gets to the point that could actually create an estimate the minute I say, I think your male cat has a bladder infection. And now all of a sudden it creates the line items that we've taught it to do for a routine bladder infection. What more do I need it to do? Oh, it can send home a release instructions. It can send home information written at a fourth grade level so the client can understand it. It could print it out so I can hand it to the client. And it can set up the follow-up phone calls that the staff members will make. Or if you really want to look at AI down the road, maybe the AI makes the phone call or sends the text. All of these different things. There are certain things doctors have to do and certain things doctors don't have to do. Let's get AI to do those things that doctors don't have to do, and where the staff can be better used for face-to-face interactions from that standpoint.
Yeah, and it's even the stuff that you don't want to do, right? But is necessary. And I am in the same boat working with a lot of these companies. And I think one of the things that I've really appreciated about some of the thoughtfulness of the forward-thinking companies is exactly to your point of there's a lot of things that I would do during the day that I didn't realize maybe took 5, 6 minutes, but we add them all up, right? I'm going to be able to save an hour, hour and a half per day,
At least.
right? When I think about things that I would love to hand off, it's not just also my workload. It's what can I unload off our CSR team, right? Because we often overload them and we're giving them checklists of things and they cannot do what we need them to do, being a service industry, which is spend time with the clients, right? And being that first and last impression that we need. So if you were guiding, let's say one of our new entrepreneurs who's opening a practice, what would you be guiding them when they're looking for an AI strategy?
One that doesn't replace, but one that supplements. Do what you like best. Find something or somebody to help you with the rest. And I think there are some things that in the AI world that are communication that we don't do really well. And those are, writing client information handouts or doing follow-up texts or emails that we can automate using AI. Anything we can automate that allows us to focus, at least on as doctors, on diagnosis, prescribing, and surgery, we allow ourselves to work to the highest level of our job description, be most productive. Because if you're calling a client back because their intestinal parasite exam was negative, you're costing the practice because you could have been in an exam room with a client. So replace those things that are not diagnosing, prescribing, and surgery for the doctors. Find those things that are staff dependent, but not staff required to use for AI. I've seen some AI phone services that can answer the phones. If we can teach AI how to play the game of Tetris, also known as appointment books, or staff scheduling. Oh, by the way, those of you who are watching, if you can come up with an AI company that can do staff scheduling, you'll be a billionaire, because that's something that doctors and staff hate to do.
Absolutely, and it's ever changing.
Yes.
So we just have a few more minutes. What other AI companies or innovation besides the scribing community are you looking at?
Well, I think there's a lot of communication AI that can be used through email, text, whatever. I also think that there are clinical AI, and we know about them, but maybe we don't group them in the same, because we've got AI being used for imaging. We've got AI being used for cytologies. I believe we have some AI being used for UAs and intestinal parasite exams. I think down the road we will start to see some surgically based assistance with robotics from that standpoint, which will be machine learning and AI. I think the sky is the limit. However, as you mentioned earlier, we got to get some lane lines up, because the minute a client walks into the room and there's a robot in there is the minute we have a problem. So we don't want to replace the human touch.
But I think it's exactly the point. We are a relationship-centered service industry, and that can be challenging, right, for many of the introverts in our practices. But that's where I think, as you mentioned, AI has so much possibility, because a lot of the things that introverts hate doing, we can use AI, again, as a supplement to enhance that experience.
Now, what AI can't replace is the AI that you and I learned in school.
It's very true.
For those of you who don't figure that one out, it's artificial insemination. A computer can't grab a sleeve and a straw.
That is very true. And as always, Peter, you always surprise me, and it's always a wonderful conversation. Thank you for your insights. Hope you'll join us again.